The people that qualify for minimally invasive heart surgery are those that are undergoing valve procedures, either repair or replacement. Minimally invasive valve surgery is performing the same operations that are done through a full sternotomy, mid-chest incision, but instead done through a small keyhole incision on the right side of the chest. The key advantage to doing it minimally invasive is less blood loss and quicker return to activities of daily life. Valve replacement surgery is done at most heart surgery centers. Most centers, though, aren't doing high volumes of valve replacement or valve repair, and most hospitals aren't doing minimally invasive. Here at Sarasota Memorial, we do have a large experience with valve operations. Specifically, I do a lot of mitral valve repair, which has benefits over replacements in many types of patients. It's more difficult to do a repair than a replacement because repairs require judgment. Replacements require just removing the old valve and taking one off the shelf that you know works and plugging it in. Repairing valves require knowing what's wrong with the valve and knowing what it takes to repair it. Most programs don't do it because in order to get good at doing minimally invasive surgery, you have to have a high volume. If you're only doing 1 or 2 cases a month, the surgeon never really gets good at doing it, and so they don't become proficient at it or efficient at it. By doing high volumes that we're doing here at Sarasota Memorial, we've gone through all of that, and we're now very efficient, we're very proficient, the teams are proficient at doing this stuff, and so that translates into better outcomes, shorter hospital stays, and more durable repairs and replacements. I think minimally invasive cardiac surgery is becoming the standard of care. I think that if you need to have a valve repair or replacement done, then I think that if you're not offered minimally invasive cardiac surgery, you should seek somebody out that can do it.